We are here today, this is Fayetteville Hyperbarics, and we're here today with Kelly and Carter. And Carter is our youngest patient. 6 months old? 7 months
7 months old.
7 months old, okay. So tell us, actually we tried to do this video before, and it didn't work out. We had a technical problem. So we are now in dive or treatment number 32. Tell us how it is that you are here today for hyperbaric treatments.
When Carter was born, he was unresponsive, so they had to fully resuscitate him and realize that his acid levels were very high. It was quickly evident that he had had some oxygen restriction sometime either during labor or a few days prior, and as a result, his body was shutting down, and he was transferred to Duke Hospital, where he stayed for the next 2 months. And formally, he's been diagnosed with HIE, which basically just means that he has suffered brain damage as a result of oxygen and blood flow restriction. So while we were in the hospital, of course, trying to save his life and heal, I started doing some research and stumbled across hyperbaric oxygen therapy and just did some more research and talked to people. And once we got out of the hospital, really started to pursue it hard to try and help him.
What are your expectations with the hyperbarics? When you researched, what did you find?
Well, I really just hope that it would just help kind of wake him up. I read some stories of people their experiences, and one mom had a son with HIE, and he also did hyperbaric treatments, and immediately just started noticing movement more, things that he wasn't able to do before. And we said from the get-go, even if he makes an inch of progress, that's still progress, and there's a lot of potential benefit for him in the long term with it, and we're just hopeful that we'll see some of that.
Well, in the 32 treatments that you've been here, and you've done one a day, we've seen a change in him. When he first came, he seemed to be very, very lethargic and was always sleeping when you walked in and when you walked out. He's starting to perk up a little bit, though. He looks like he's ready for
yes,
kind of treatment.
He is
but
ready for
his eyes were open before. Tell me what else you've seen for him.
Within the first week, his mouth started moving more. Prior to any treatments, and while he was in the hospital, he couldn't eat by mouth. He wouldn't suck on a pacifier. He had the feeding tube placed in his stomach because he couldn't eat by mouth. And the very first dive, while we were on our descent, he took his pacifier without support, and he had never done that before.
Because that helps clear his ears too, so he knew that.
Yeah, so it was kind of like instinct kicked in, which was really comforting because he was able to do it and do it on his own. And then in the weeks prior, he started making more progress eating by mouth, and we're down to very few tube feeds now. He's pretty much eating by bottle, and
very good.
The biggest improvement that we've seen is with his eating, and it directly correlated to when we started diving. And like you mentioned, he is more alert. He's awake more. He started to move his arms and hands more, and we've got a long way to go, but the diving has been extremely beneficial for him.
Good. And so, so you're saying he's eating more. Now, he has a specialist that helps him with eating, is that right?
Yes, we started feeding therapy with him. Ironically enough, he had been eating with his bottle about a week prior to starting feeding therapy. So the feeding therapy and the stretches, I believe, have helped, but he kick-started it on his own, and I attribute a lot of that to the diving.
To the hyperbarics, okay. And is he doing physical therapy or any other kind of therapy?
He is. He just started physical therapy. We've had a few sessions, and seeing some changes from that. He got a long road to go, but I think the hyperbaric treatment in conjunction with those other therapies, they're going to work really well together.
Good. And how about sleeping patterns? How's he doing with sleeping?
Well,
he is 7 months old, so they have minds of their own.
That's right. It varies. He gets a good stint in. He still kind of has days and nights a little bit mixed up. We're working on that. Last night he gave a good stretch for 4 or 5 hours, which I was pleased with. So it just kind of depends, but we're getting there.
Good. So anything else? Now, he has a big brother.
He does have a big brother.
So anything else that you'd like to share with us about his changes that you've seen in these past 32 days, actually?
Yeah, 32 days. Biggest thing, like I said, is the eating, and he definitely is moving more, more alert. Within the first couple of weeks, I took a picture after we started and sent it to my sister, and then sent her one that was pre-dive, but didn't tell her which was which. And I asked her to pick. I said, which one, which one's before and which one's after, and she said, cell phone pictures, hard to tell a little bit, but she picked it right. She said, look, he looks brighter, he looks more alert,
right?
Exactly. He looks his color's better, and there are a lot of contributing factors to what's going on with him day in and day out, but the one consistent for the past month has been the Hyperbarics.
Right. Now, when you go into the monoplace chamber, you actually are going in with him. And so, how are you feeling?
I feel great.
Yeah, you feel good.
You walk around and I think, oh, well, that used to hurt, but I don't feel it now. And
yes. Well, that's good. Well, we actually have another mom who's going in with her child, and she has rheumatoid arthritis, so she's really seeing some good things happening too because of that. Well, good. Well, we're glad Carter's going to be with us for a little while longer until he finishes. Yes. And he looks like he needs a nap. Yeah. Well, thank you. Yes. We're waiting for him to come in with a big smile on his face.
That's right.
Yeah. Well, thank you so much, and we will